Welcome today to this roundtable discussion on the Equity Learning Collaborative Program. And on behalf of Community Health Plan of Washington, I'm Meg Olberding. I'm the Director of Public Relations and Brand Messaging for CHPW. Thank you all for being here today. What I hope will be a really interesting hour together. Where we're going to talk about kind of the community work we're doing to advance equity in some really tangible ways in communities across Washington. Before we begin, a couple of housekeeping rules or items. This is being recorded. We do intend to take portions of this and reuse them with media, reuse them on social, and hopefully share these out as learnings for folks who are in the program as well. There is a link, Terry, my colleague Terry will put in the chat to the press release as well if you need that during our time together. Before we begin, I thought we'd just go around and introduce the folks who will be speaking and making presentations, and then we will, after the presentations are made, we'll open it up for more of a discussion. So let me start with our guest, Michelle Sullivan. Michelle, would you like to introduce yourself and your role?
Certainly. Hi, I'm Michelle Sullivan. I am the Chief Quality and Compliance Officer with Yakima Neighborhood Health Services.
And Sherry?
Hello, I'm Sherry Williams, Vice President of Community Engagement and External Relations for Healthpoint Clinic.
And Angie?
Hi everyone, I'm Angie Perez. I am the Support Services Manager for Unity Care Northwest.
Great. And then Jennifer?
Hi, Jennifer Polello, Community Health Plan of Washington. I'm the Senior Director of Quality and Population Health.
Great. And then Leanne.
Gotta get off mute. Hello, I'm Leanne Burge, and I'm the CEO for Community Health Plan of Washington and Community Health Network of Washington. Happy to be here today.
Great, and we have some other folks on the call as well, and as we open up for the discussion, they may join in and we'll be happy to introduce themselves as we go. But for now, Leanne, I'm going to turn it over to you and to offer some opening remarks on really the CHPW equity work that we're doing and in the broader context.
All right, well, thank you, Meg, and I appreciate everybody's participation today, because this is actually an area that I am really passionate about and is just fundamental to who we are. First, who are we? We're Community Health Plan of Washington and Community Health Network of Washington. We have been around for almost 30 years, and we were founded by community health centers who have historically been the providers who have served those folks who are most in need of services that have not been able to access services through traditional medical and other avenues. So our entire mission and purpose has been to advance health equity for populations, communities, individuals who have had barriers to the opportunity to achieve their greatest health and well-being. And so it is really fundamental to everything that we do that we are focused on advancing health equity for our members and working in partnership with our providers to do so. It is really fundamental to the community health centers and all of their work and history over the many decades that they've been in supporting and serving these communities. We take an approach to health equity that is multifaceted. We think of our role in a lot of different ways that we can support and advance health equity. One of those ways is through the quality improvement framework that is really fundamental to how health plans and providers work to improve the quality of care that people receive. And we think about this from a very broad perspective, not just in terms of the care that people receive in their physician's office or within the medical system, but really the services that people need to be healthy that include social and broader services that relate to their health and well-being. So when we think about the work that we're doing under this program, it is not limited to clinical services. It is a much broader array of services that are often thought of as the social determinants of health. We as a health plan have been very much focused on health improvement through a quality framework for a long time. But we're being very intentional in thinking about it through an equity lens. And just to quote Don Berwick, one of my personal heroes, who has been a quality improvement leader and founder of the Institute for Healthcare Improvement, he has said publicly many times that there can be no quality without equity. And that is a very fundamental principle, that we have to think about equitable care and equitable outcomes, irrespective of the patient's socioeconomic obstacles, gender, geographic location, cultural background, ethnicity, racial prejudice, and so forth. That we have to be looking at how we can improve people's outcomes that are particularly faced with these challenges and that result in health disparities. And we know that the disparities are really glaring, and it's so important for all of us that we reduce these disparities. So it's with this lens and purpose that we have been fortunate to work with the community health centers and work with our partners also at Healthcare Authority around improving and advancing our work towards health equity. And very specifically, we were fortunate to be part of a national learning collaborative that has given us best practices associated with understanding the root causes of many of the disparities and seeking interventions in the quality improvement cycle that can improve outcomes and reduce disparities. And it's with that as our focus that we have been working with the community health centers, specifically around this learning collaborative program that's part of our discussion today. And we have, as part of that program, funded specific projects that are unique to each community, recognizing that every community has different challenges and different barriers that impact health outcomes. And so we have recognized that it is best to empower the community health centers and empower the members in those communities as a way to address the inequities. And it's from that perspective that we have provided this funding of approximately $750,000 spread out among the 15 community health centers who have participated in this program. And I think with that, I'm going to turn over the microphone to Jennifer Polello, who has been instrumental in shepherding this program over the last year. So Jennifer, would you like to speak to that more details?
Absolutely. Thank you, Leanne. Well, as you know, last year was a very difficult year on so many levels, with COVID at a high point, impacting communities of color at a disproportionate rate. And of course, the murder of George Floyd. We really wanted to focus on an equitable approach to reducing disparities across our network. As Leanne mentioned, equity is an essential element of our quality improvement program, and reducing disparities is at the heart of that ongoing effort. Providing equitable care is one of the 6 domains of healthcare quality, which is defined in a framework by the Agency for Healthcare Research and Quality. And it continues to be a focal point in national care transformation efforts. However, as Leanne mentioned, we can't do this work alone, and engaging our community health centers is an important component of this ongoing work. So our quality improvement team wanted to create an innovative approach that would allow for the creative design of interventions that targeted our underserved communities. Most grant projects are typically very prescriptive, and we felt this project should be more collaborative in nature and at the discretion of our community health centers, as they truly know their patient population. So we decided to design this learning collaborative project with that collaborative spirit in mind and allow the community health centers to create a project that works for their entire patient population, not just CHPW members. And one that would lead to hopefully some type of equitable clinical transformation around equity. The community health centers were able to design a project around one of the 4 topic areas with a specific focus on equity, looking at member experience and access to care, pregnancy care, chronic disease management, or depression management. And these topics were left intentionally broad to allow the community health centers to craft an equitable intervention that meets the needs of their clinic population. And as you can imagine, this was an interesting process at first, because many of the community health centers who, they're used to working in lots of grants and have grant opportunities, were a little confused by this open and broad approach that we established. But they also welcomed the opportunity to create something transformational that brings equity to the forefront. As part of the project, the community health centers provide quarterly reports on identified outcome measures selected as part of their project and that are in alignment with the designed intervention. Community health centers were asked to create their measurement plan with specific metrics that can be tracked by race, ethnicity, language, and then tied those outcomes back to their outlined project goals. In addition, the plan has been providing ongoing technical support to share progress and support for those that need assistance. We've also been supporting and facilitating sessions that enable the community health centers to learn from one another along the way. This peer-to-peer learning has been a very valuable part of the project, and it's fostered a lot of additional opportunities for community health centers to connect and learn from each other in this work. The goal is to elevate equity in the work we do, both at Community Health Plan of Washington and across our community health centers. Therefore, all of the best practices will be collected and disseminated across the network for continued shared learning opportunities. Overall, as you might have seen from the press release, we had 15 community health centers participate. 6 chose to focus on member experience and equitable access to care. 2 are working on equitable pregnancy care. 4 are working on equitable depression management. And finally, 3 chose to tackle equitable chronic disease management. We're really excited to share some of the highlights of this work with you today. So I'll pass it back to Meg, and we can hear from a few of our community health center partners that have joined us today. Meg?
Thank you so much, Jen and Leanne, for the framework for our discussion today. I'm really pleased that 3 of the 15 CHCs are here to give kind of a closer look and examination of their projects. And we'll start with Sherry Williams from Healthpoint.
Hello, everyone. I just want to make sure you can hear me.
Yep.
Hello, everyone. Again, thank you so much for inviting us to this forum. Again, I'm Sherry Williams. I'm the Vice President of Community Engagement and External Relations for Healthpoint. And I'm the executive sponsor along with Michelle Glatt, who is the Vice President of Population Health on this project. Healthpoint is located in King County, and we have 10 clinics in South King County and 2 clinics in East King County. And just want to start out by saying that really want to acknowledge CHPW for the development of this Advancing Health Equity Initiative and its investment in the CHCs. This is allowing us to build trust, develop programs, learn and create better health outcomes in the communities that we serve. Again, Healthpoint appreciates this opportunity to learn more from our communities, and it will allow us the flexibility to improve our approach of care delivery. Our focus project is to develop and deepening the Healthpoint's relationship with the Hawaiian and Pacific Islanders communities. And this includes our patients, our families, their communities, and our staff. We want to become a trusted and a trustworthy partner in care delivery with our Pacific Islander patients and support and better resource the needs that they have identified. What work are we doing? We're bringing together listening sessions with current Pacific Islander community health boards, associations, and community groups. We're allowing the groups to get to know us better as providers, as a resource, and also as a friend in the community. We come together around food, festivals, and fun. We come together to share information, resources, trainings to improve our cultural relationships. And we are building a collaborative and a collective partnership with the Pacific Islander families and their elders. Healthpoint has developed a health equity advisory council to dig deeper into the health disparities and the social determinants of health that are barriers to quality health care. We are engaging our Pacific Islander staff and providers to learn how we can be a better healthcare delivery system, again, in our South King County and East County region. Our early findings showed us that improving the health of our partners is the most important aspect. We recognize that it takes time, patience, commitment, and trust to do this work. How do we measure success? We were able to engage our Marshallese community when the COFA, which is the Compact of Free Association Islander Insurance members, needed to enroll in Medicaid and Apple Health. Due to our relationships with this community, the Marshallese community and the Pacific Islanders communities, we were able to be proactive in translating materials, develop flyers, and be prepared to help and explain and register our community members. Our call to action for this work is to provide access, build community, and the quality and equitable care delivery system that we are currently in existence. We know that there is more work to be done, but we appreciate and thank CHPW for this Advancing Health Equity Initiative Fund. It is allowing us to learn and move forward together in our communities. So thank you so much. We are really truly making an impact in our Hawaiian Pacific Islanders population.
Thank you so much, Sherry, for that overview, and really important work, certainly now that we have the COFA in place and welcoming all communities in. Next, I'd like to turn it over to Michelle Sullivan with Yakima Neighborhood Health Centers.
Thank you. Yakima Neighborhood Health Services is pleased to partner with the Community Health Plan of Washington in this important work. In 2005, YNHS received our first federal grant to provide healthcare services to individuals experiencing homelessness. We have found this work to be both rewarding and challenging. One of the challenges we have learned about is that the social determinants of health faced by our patients experiencing homelessness extend beyond the lack of housing. This was made even more evident with the COVID-19 pandemic. Our patients experiencing homelessness underwent many difficulties with quarantining and social isolation, with accessing current and accurate information regarding the pandemic, and with connecting to healthcare services when in-person care was limited as a precaution against spreading COVID-19. Additionally, we are seeing the impact of the pandemic on the mental health of all of our patients, with higher rates of depression being experienced. A concerning trend was found for our patients experiencing homelessness, however. We found our patients experiencing homelessness were overrepresented in patients missing follow-up on their depression. We are working with Community Health Plan of Washington Learning Collaborative and engaging community health workers to reach out to our patients experiencing homelessness. These community health workers will assist our patients in securing access to digital technology, so things like smartphones and internet connections. They provide education on virtual ways of accessing healthcare. So this could be things like using our patient portal, making electronic requests for medication refills, and participating in telehealth visits, as well as utilizing calendars and reminders to increase the rate of depression follow-up. Thank you.
Thank you, Michelle. Thank you. Really important. And we know, homelessness has so many effects, and depression is certainly one of the biggest issues that we have to face with our homeless patients. I'm now going to ask Angie Perez from Care Northwest to share a little bit about their work.
Sure. Thank you, Meg. So I'm Angie Perez. I'm the support services manager here at Unity Care Northwest in Bellingham, Washington. We have 3 sites. One is in Ferndale, which is about 20 minutes north of Bellingham, and then 2 sites in Bellingham. And recently, equity and inclusion has been the focus here at Unity Care Northwest. Many of our employees who work in our support services department, including our call center agents and our receptionists, have voiced concern in the past and recently around our patients who need interpreters, and the fact that they were needing to wait a little bit longer to be seen when they're trying to book an appointment. The reasons behind that currently is that we require a 30-minute appointment, regardless of the reason for the visit. Currently, we're using in-person interpretation and telephone interpretation, which can sometimes lengthen the time of the visit. In addition, in a busy clinic, sometimes a 30-minute appointment can be kind of hard to come by. So the unintended outcome is a longer wait time for our patients who need an interpreter. When these concerns were brought to our attention, we as an organization committed to creating equitable and timely access to all patients. I was excited when my COO, Shannon Hardy, brought the CHPW Learning Collaborative Grant opportunity to my attention. And so we decided to use the grant funds we received from CHPW to help decrease the wait time for our patients needing an interpreter. In addition to reviewing our internal processes to identify areas for opportunity, we will be implementing video interpretation in our clinics. We plan to start by implementing video interpretation in one of our sites. And then once we optimize that, then we plan to roll it out to all sites and programs. We also want to thank CHPW for partnering with us on this. We appreciate their support and commitment to advancing health equity in our state.
Thank you so much, Angie, for that overview. I think now, before we go any further, I just would like to open it up for any of the media who are on the call, if they have any specific questions you'd like to ask anyone, and please feel free.
Since I'm here, if you don't mind, Kyle Pauly with KXRO in Aberdeen. And I guess since I've got all the professionals here with us today, I guess with this funding that is going out for the individual departments, I mean, how much good could these do? I mean, how much of a benefit will these funds go for the individual departments? I know that it is a kind of a blessing to each of the departments, but what kind of impact will this have?
So I'd be happy to take that.
Hopefully I stated that correctly. I mean, it's a great thing, but I just want to get some sort of confirmation. I mean, this is going to reach so many people. Realistically, I just kind of want a quote of the impact that these funds will go to those who are deserving and in need.
So I would like to give you my perspective on that. You know, what I'm really excited about this program is that it's an opportunity to pilot great ideas that can then spread and be replicated across our network of community health centers. So the fact that it is so open with, you know, guidelines around the purpose and goals of the dollars, but without being proscriptive in how the dollars are used, gives us great opportunity to learn from each other and then replicate the best practices. I think what we heard today of those 3 different examples is just fantastic, because there's 15 other, you know, this total of 15 examples. And within those 3 examples, we have opportunities for the other CHCs to learn from the work that's happening within the respective communities. So the idea of providing cell phones, for example, for folks that are homeless, and what the benefits of that can be, we can pick that up in other areas and replicate that. The idea of ensuring that appointment times are not delayed because of interpreters, we can pick that up and replicate that in other areas. So I think it's really exciting that within each of these communities, there's such a broad array of opportunities that definitely impact those areas. But the real joy for me is to see that this can be expanded beyond those individual CHCs going forward.
Angie or Sherry?
I'd like to add,
Yeah.
thank you, Leanne. And I just want to, you know, put some stock into what community engagement really means. It means being at the table, and then listening and learning from the communities that we serve, and then applying what those needs are to the long-term care of a specific community, family unit. And those are the far-reaching evidence that can show the overall health of a community is changing, just due to a collective trust and understanding, and how healthcare is more than a transaction. It's an opportunity and a collaboration. So the measurement with regards to, again, our program is how we see, again, our Pacific Islander communities trusting us more with their care plan, which means more of the family members will come into our clinics, which means that they will continue to follow their care plan, and which means that they're living longer, healthy, and thriving. So that's how I see the measurement of the work that's being done through this investment.
Michelle or Angie, do you have anything you want to add to that?
I do. You know, it's my hope in the work that we're doing around the digital health equity is that it expands beyond digital health. You know, one of the other areas that I think we all noted that there were some risks occurring during the pandemic was for kids that were now no longer in a school setting and were receiving education from wherever their home might be. And for our patients experiencing homelessness, those kiddos really struggled even more with being able to access online school when they didn't have those resources available to them, and parents might not have known how to utilize those resources even when the schools provided them. So it's really our hope that that our participants will be able to generalize these skills that they learn beyond just healthcare and apply it to, many other settings, including interacting with their children's schools.
I'll open it up at this point if there's other discussions or if there's other questions folks have, any of the reporters or other folks on the call today.
It looks like we have one question from Michael Whitney.
Sure.
He asked, organizations not on the panel are conducting chronic disease management care. What have your organization learned from the work done by the organizations conducting the chronic disease management care?
Maybe Jen can speak to that.
Jen, or I was going to say, Kristen.
I know Kristen's on the line. We have the 3 CHCs, CHC Tacoma, CMAR, and Tri-Cities that are doing projects around chronic disease management. Projects range from providing blood pressures for in-home monitoring, a diabetes management program, and actually a couple of them are doing the blood pressure cuffs for in-home monitoring. So Kristen Stagner is our care improvement manager and works closely with the CHCs on this project. And Kristen, I don't know if you have heard anything from those 3 CHCs on anything that they're learning at this point from their work around their chronic disease management programs.
Sure, I can give a few highlights with those CHCs. So they have been really focusing, we have 2 CHCs focusing on blood pressure, and then CMAR is tackling both just the full diabetes management care. So from a blood pressure perspective, there's been a lot of focus on providing instructions in several different translations to patients so that they can appropriately take their blood pressure and report it to their providers during telehealth visits. And so we've noticed a lot of gaps in care when it relates to Russian-speaking patients, for example. And so we've provided instructions and working with our health coaches here at CHPW in those translated languages to help get those out. And then also provide the means to provide blood pressure cuffs in all sizes. So one thing that we've learned is that blood pressure cuffs, the one size fits all, doesn't truly meet the needs of the full community. And so working on ordering extra large blood pressure cuffs is a win there. And then I do want to highlight the Pacific Islander community. CMAR is conducting a focus group with patients diagnosed with diabetes in the Vancouver area later this month to help understand from a cultural perspective how to best meet those patients and give them the care that they need at this time. So more to come out of that, but they're using the funds to create this focus group, get out in the community and really hear from the patients themselves to say, how can we best care for you? What are some barriers that are preventing you from going to see your doctor or making sure that we're able to monitor your diabetes? Does that help answer the question?
Great.
Thank you, Kristen.
Maybe we can talk a little bit about, this collaboration and what it's like to be working with other CHCs to really look at the issues of equity and what kind of similarities are you seeing with other CHCs in regard to advancing equity and what I think are really tangible and concrete ways. Angie or Michelle or Sherry, do you have any thoughts about that?
Sure. I have really enjoyed the monthly meetings that we have with our cohorts, those others that are working on similar projects. It's been very informative and just great to bounce ideas off of people, hear their ideas, share concerns and struggles, and find that we have similar concerns and struggles with this work that we're doing. And it's just been a great support, and I appreciate having that opportunity every month.
And can you talk what are some of those supports and struggles that you all have identified, or some of the commonalities you share?
So in the team that I've been meeting with, it's really around, has been more around finding the time, given everything else that's going on right now with COVID and everything. It's just kind of hard to dedicate the time and find the resources. Staffing is an issue. There are just a lot of similar things that are happening that are kind of that make it a challenge to get this work done.
And hi, this is Sherry. I totally agree with you, Angie. Capacity really is bowing with the type of work that we're all doing every day. And I also feel that, and I think getting back to translation and interpretation of materials, and keeping up with the opportunities to publish and develop new.
This is Risa.
Oh,
Hey, I'm good. Thanks for calling me.
You're on speaker.
Risa?
You need to go on mute.
Yeah, it is. Oh, yes. Yeah.
let's see if we can we mute her? Okay, great.
There we go.
Thank you. Sorry about that, Sherry.
Technology. Gosh, where was it? Okay, interpretation and translating materials in a timely manner to keep up with kind of the current issues, even around COVID, around outreach. I mean, we are fortunate to have a translation services that can respond to us, but again, the bandwidth, the ability, the time frame, those things tend to be barriers, and not allowing us to really stay focused on the project and program. But we are invested on keeping our engagement practices with the communities that we serve.
And why, I think it's really interesting, and maybe for some perspective for the media on the call. I mean, how broad is and how diverse is your patient base? And so when we talk about working with a population, can you give some context about how your organization, how many different cultures and languages your organizations actually reach out to, and why this is important? If you study it in one, why that could be helpful? And Angie, Sherry, Michelle, Kristen, maybe there's some other perspectives you want to bring to that, but if you could talk about kind of the role with community and building communities that CHCs hold, that would be really, I think, some good perspective.
Well, I can say that we have over 100,000 patient population that flow within our clinics. We also have school-based clinics. We have an emergent care clinic, and then we all have varying disciplines that we support. Again, yes, our South King County is one of the most diverse counties in the state of Washington. And we, again, try to reach out and provide a diverse employee base that could help inform and educate us while we care for our patients. I'll say that because of the diversity of the population and the language diversity, it is an opportunity for us to do better. But knowing that providing equitable care is where the challenges lie, due to the amount of, again, appointment times, the providers' needs and requirements, as well as the support services and resources needed to engage our patients to be part of their care plan. So I don't know if I answered your question, but I'll say that the diversity is wide and broad and deep, and that our employees, our staff, and administrators are engaging with different options to be able to support and opportunities to support our patients in an equitable way.
Great. Are there other questions that folks have that they want to talk about?
Kyle, it looks like
Go
you have
ahead,
your
Kyla.
I've got a couple questions if I can, but
Sure.
kind of a follow-up. This may be a question for Sherry, or for the panel in general. When we're representing Grace Harbor County and just looking at the latest census numbers, our diversity, our area is becoming more diverse, but we're still nearly 80% identify as white. I mean, Pacific Islander is 0.18% of our population, and there's such small pockets of diversity. So in an area that does not have that diversity, of course, we have CMAR, which is a CHC that's a part of this, but how can those smaller diversity groups assist in their own community without having to travel into Thurston or elsewhere? I mean, what can be done in our local community for these people looking for needs that best suit them? Hopefully that made sense.
And I'm sorry, Kyle, was that directed at Sherry in particular?
It can
anyone?
anybody on the panel that's listening. The Pacific Islander that Sherry was mentioning kind of made me start to jot down notes. But I guess for an area that lacks in diversity overall, with our largest minority group being 5%, with our American Indian population, what can these smaller pockets do to find equitable health opportunities locally without all going into just the CMAR locations and overwhelming them as part of the CHCs?
No, I could just speak very generally to the fact that when we talk about health equity, it's a broader understanding that there are barriers that folks face in addition to their ethnicity and their racial makeup, such that the principles of health equity are much broader, and it relates to supporting individuals and empowering individuals to achieve their highest degree of wellness, despite what the barriers are. And often it's about socioeconomic barriers, and that obviously impacts white populations as much as anyone. So the principles are very important to apply across populations, and it's not limited to racial minorities, just as a point of fact. But in terms of how we support ethnic minorities or groups that are really in small numbers in a particular community, one of the tenets of the community health centers is to partner with community-based organizations and to be patient-centric in terms of understanding the individual needs of the patients and working with those patients and their families to connect them to community supports. And even within, even in an area that there may be a small number of a particular ethnic group, there are community supports, churches, families, other types of institutions and social structures that are there as part of the community that it is quite possible to leverage. And it is the role of a community health center and the role of our health plan and the services that we provide to help connect people to those resources.
Thank you.
And certainly, I think we see that in the examples from Yakima neighborhood health centers, and that's a homeless population that they're using for their project rather than an ethnic or racial demographic that they're looking at. So, so I don't know if Michelle, if you have anything else you wanted to add on that.
In terms of numbers, no, but in terms of perspective, as a community health center, I think that we are very much charged with providing care to those who seek care, and to do that in a way that is respectful and equitable. And I've had the privilege of being here for a very long time, since 1995. And have done home visits with people of many different backgrounds. And if you approach something humbly and with a desire to learn and provide, I think that goes a long way to having all feel that they can seek the care.
And I'd just like to add, I think this is an opportunity to educate community members on the populations that who their neighbors and the cultural aspects of who they are, to take the responsibility or the accountability to be more part of the community by educating yourself, educating your families, reaching out to bring some education and training to the communities to get a better idea of not specifically that pocket of individuals, but to broaden your own point of view of what equitable care, equitable relations and opportunities to be again, a better steward and a better neighbor for the community as a whole.
Looks like you have another question.
Yeah, one more, and then I'll give it over to Michael or anybody else on the call. But just in June, there was the additional funding going out to CHCs with that $10,000 unrestricted grant funding. And now this announcement coming out today in this press conference. So kind of in the future, as far as CHCs or local organizations that are working towards the same goals as everyone on this call today, what opportunities for them, for those that might not be reached already, that what should they be looking forward to? Is there other opportunities in the timeline going forward for them? Are there additional funding opportunities coming up, I guess, is the question.
Right, and just to clarify, the $10,000 that we announced earlier, that $250,000 grant opportunity was towards community-based organizations as opposed to community health centers. So wanted to clarify that. And Leanne, I think you probably wanted to.
Yeah, I did want to talk about the community-based organizations are often social service-based organizations. They may also provide behavioral health services, but they're typically partnering with community health centers, partnering with the health plan to provide that broader support, less clinical support typically. And they are, very much embedded in the community and are focused on their support for the populations that are most in need. So, we do look to be as impactful as possible with how we provide additional funding. And, it's just part of our operational role to continue to contribute to our provider community and certainly the community health centers through a variety of mechanisms. But the reason that we were focusing on this in particular was the intentional directive around new projects associated with advancing health equity.
Thank you.
And it looks like, Michael, you had another question. I don't know if you want to say it or if you want me to read it, but did you have a question about the funding? It looks like it says, once the grant funding is used up, how can an organization continue these efforts that have costs associated, such as the equipment or manpower as interpreters? Will more grant funding rounds be required? So I think you answered that to some extent. But does anyone else have any thoughts on Jen as part of the quality programs, or Leanne, or anyone else?
Well, I would just say that we have a long-standing relationship with the community health centers to provide reimbursement through value-based contracts, and we do this actually beyond our own community health centers, but it's a more way of transforming care with value-based contracts, which enable innovative use of funds for the overall improvement of people's health and quality outcomes. And we hope to continue these types of funding through those value-based contracting arrangements.
And I see Kat Latte has joined us. She's also very involved in the CHC program, and maybe she or Jennifer has some information too on how you all are talking in the cohorts about the sustainability of these efforts.
Sure, this is Kat. I'm the Director of Health Systems Innovation at Community Health Plan of Washington, and happy to chime in with respect to discussions around sustainability. So one point, in addition to what Leanne shared, related to the overarching component of value-based payment being a sustainability mechanism, each community health center did have to map out a sustainability plan within their application. As we are looking into next year, one of the areas that has really been elevated during the cohort conversations and learning collaboratives is related to some core competencies or capacities that we've identified within the community health centers around building a culture of equity and really being important in partnership with the specific programs that are rolling out. And so we are in the process of moving through the next steps for 2022, but do envision a continuation of what this would look like with the community health centers, with centering that focus on some of what Sherry spoke to. How are we really ensuring that we're involving those most impacted by the work in the work? So really partnering with our communities and consumers. How are we building equity into program design across the work that we do? How are we really diving into our data and ensuring that we have disaggregated data by race, ethnicity, language, and really thinking about ways in which both we can explore that further, but also recognize what other types of data or measures are necessary that individuals really value. And so again, sort of thinking through how we might be able to sustain some of those culture of equity capacities that we as an organization and that we've seen in working across the community health centers are really desired to continue to build on and share across the community health center collaborative.
That's great. Thank you, Kat. And Michael says he has no audio, so hopefully that answered a bit of his question. And as we wrap up today, I would just like to open it up if there's other thoughts about the collaborative program, any other final thoughts on what you or your organizations have really appreciated or valued in this process. Any final remarks?
I just want to just
Go
thank
ahead,
again
Sherry.
the CHPW, and I want to just focus on the flexibility and the open-endedness of this opportunity for us to be able to really dig deep and determine what we as CHCs feel is the most valuable population, how we could really determine the inequities, and then how do we provide a system or process around that to support the communities that we serve. And then to be able to still report out, have the data and all of the qualitative and quantitative information and measures that will make it successful, and that we can share the information for better practices across the state. So I just wanted to just call that out. I think that is a big plus and a value added.
Thank you, Sherry. And Leanne, do you have any closing thoughts for us?
I just found this session really helpful for me to hear the specifics of how the funds are being used. And I really look forward to hearing more as the year goes on. I'm very, very pleased that we have this opportunity to work together. I don't think that there's a better way to develop solutions than through this type of collaborative approach, where people can really dig in, as Sherry just said, and where we do have the freedom to look for solutions that are innovative and not be paralyzed by, sometimes we just get stuck on inadequate data and a need to prove return on investments. And that's just can be a paralyzing criteria. So I'm very pleased that we have this ability to work together and learn together. So thank you all who are participating.
Thank you all so much. Appreciate your time today, this afternoon. It's been very informative, very instructive, and really excited to see where these projects go, and our work together continues. So thank you all so much, and have a great afternoon.